And good morning. It is straight up and down. I should say good noon. It's straight up and down 12. I just ran in from the front. We had somebody come in today that I really have been playing telephone tag with and needed to see. So I'm a little breathless, but I'm glad you're here. Today we are on part 2 of Why Am I So Tired? So for those of you who were able to join us last week, we talked about adrenal fatigue, vitamin B12 deficiency, and also candida. So if you think you might have any of those issues, then I want you to go back and find us on Facebook Live or find us on our YouTube channel and look at the Why Am I So Tired Part 1, and you'll be able to catch up with us. Today, I don't know how many of these reasons we're going to get to. We have 16 different reasons, and I have only just gotten on for 30 minutes. It's our 30-minute window, and so I don't know how many of these I'll get through, but we'll go until we run out of time, and then I'll come back next week and try and finish up here. So the fourth thing, or the fourth reason that we could be so tired is that we are depressed. Now, all of us are situationally depressed. So there's a difference between situational depression and clinical depression. So situational depression is when something is going on in your life that's not happy. Your husband loses his job, your kids are in trouble, you didn't get the pay raise you were wanting. All of those are situations. The situation I'm in is making me depressed. All of us have that from time to time. And normally, if we're healthy, if we're emotionally healthy, if we've got a good support group, if we pray, meditate, all those kind of things, then we can get ourselves out of the funk, okay? But sometimes if you're clinically depressed, you are crying all the time, you can't get out of bed. There's all kinds of different things. And so if you are clinically depressed, then you need to go and see a psychiatrist. I know a lot of people just go and they get psychotropic drugs from their general practitioner, and I am not a fan of that. I'm just going to be straight up honest with you. If you need medication, and sometimes we do, when my husband died 20 years ago, I did not know about holistic healing and holistic health. And I was depressed. I was depressed because my husband had died. And I had talked to a friend of mine who was a psychologist. They can't prescribe meds. But as soon as my mom, I was going through the grieving process, and my mom said, you need to go and get on this particular medication. And I had seen what the medication had done for her and for my siblings, which was not a whole lot of good, and I just didn't want to do that. And so I asked my friend, who is a psychologist, do I need to do this? I don't know. And he gave me some very wise advice. He said, you're situationally depressed, which is normal. Now, if it goes into clinical depression, then you're going to need to go see somebody. And I have a Christian psychiatrist that I can point you in the right direction. And that was really important to me because as a believer, I had certain and I have some wrong belief systems. So didn't plan on talking about this today, but obviously maybe somebody needs to hear this. So in my belief system, I grew up in a charismatic fellowship, and I still go to a charismatic fellowship. And I had heard all kinds of teachings that if you love Jesus and you had the Holy Spirit, then you could not be depressed, because depression was always a demonic entity. And so that's what I had learned, and that's what I believed. And I did not think that I would go into depression because I'm a very strong believer. And so after my husband died, I had some counseling. We had a pastor at our church who was a counselor. And I did some counseling sessions for quite a while. And besides my husband dying, we had other family issues because of the death of my husband that were very, very difficult for me. Anyway, fast forward to about 11 months after my husband died, and I am teaching in a Christian school, and the children would come in and they would say something very innocuous, just the everyday, hello, Miss Heil-Mealey, how are you today? And I would start bawling, and it was like, oh, I can't function here. And so I remember what my friend had told me, that if I moved from situational depression into clinical depression, it would absolutely disrupt my life. And so I will tell you that I went and saw this psychiatrist, and she was a believer. She went to my kind of a church. And I told her, I'm having real trouble being here because my belief system. And she was very good. She was very good. And she said, if you had a heart attack, would you think that it was a crisis with your relationship with Jesus or your relationship with the Holy Spirit? And I said, no. I said, if I had a heart attack, I would think that my heart was in trouble and I needed to get to the doctor. And she said, it's the same way with your brain chemistry. She said, you have suffered a traumatic loss. And she knew some more of the story, which was more traumatic. My grandmother had died the year before, 6 months before. And she said, your brain has suffered a traumatic injury and your brain chemicals are not functioning. It has nothing to do with your relationship with Christ or your relationship with the Holy Spirit. It has to do with your chemical factory being broken, and we can help you with some medication. And sure enough, she gave me some medication, and within 24 hours, I was good. Seriously, it was a miracle. I was good. And so I'm just going to say, if you need to have some medication because you are clinically depressed, I want you to go to a psychiatrist. I do not want you to go to a medical doctor because medical doctors do not know how to titrate psychiatric medicine. Just going to throw that out there. They have the best interest at heart and all that kind of stuff. But I've talked to very, very many professionals on the way, and they all tell me the same. If you need to have psychiatric medication, then you need to go to a psychiatrist who is specially trained in that kind of medication. I will just tell you even this week, I had a patient that came in who had been prescribed some medication, and the medication was just sending this poor teenager into a spiral. And they took him to a hospital, and they were able to change the medication, and within, I think, about 48 hours, he was back where he needed to be. So these are things that if you are depressed, there's no shame to that. There should not be shame to that. The brain factory is broken. Your brain makes your neurotransmitters. Your brain makes your serotonin, your dopamine, your GABA, all those kind of good feel-good chemicals. And if your brain is broken, it can't do that, and you're going to be depressed because your brain is broken, okay? No harm, no foul, nothing to do with Jesus or anything like that. So I asked her, because I'm just kind of argumentative sometimes, and especially when I'm hard-headed, and those of you that know me know that I'm very hard-headed, and I said, well, during pioneer times, there was all kinds of trauma. There were Indians, and there were deaths, and there was deprivation and all that kind of stuff. And they didn't have neurochemicals. So, how did they get over all this? And she said, well, you will eventually come out of this, but it'll be 3 to 4 years. And when I thought about, my children were teenagers, and I still needed to make a living because I was the only breadwinner in the house. And so when I thought about going through what I was going through for 3 more years, I thought it would be better to bite the bullet, so to speak, and get the medication, and I'm so glad I did. If you're going to get the medication, get it from someone who is qualified. So I'm going to go back to my notes now. That's all my true confessions for the day. I hope. I'm not a fan of true confessions, but I just felt like somebody needed to hear that. All right. So this says depression. Most of us feel sad or lonely or overwhelmed by physical problems, okay, that significantly impact our day-to-day activity. So that's the key, if it is significant. If it lasts for months, then you are likely dealing with clinical or major depression, disrupt your sleep, and make you even more tired during the day. So we want to make sure that we look at that. So here are some symptoms here, okay? Fatigue and reduced energy, trouble with memory or concentration or making decisions, feeling worthless, feeling guilt, feeling helplessness, being irritable, okay? So not just your regular old irritability, but irritable, feeling restless, insomnia, or excessive sleeping, either one, loss of interest in hobbies or activities that were once pleasurable, have those kind of symptoms there. Loss of appetite or overeating. I will just tell you, my mom hugged me during this time and she said, oh my goodness, child, I can feel absolutely every bone in your body. And I had lost probably 40 pounds in that year just because when I'm stressed, I don't eat. I'm not a stress eater. In fact, I'm just the opposite. When I'm really, really stressed, I don't eat anything. Feeling of hopelessness or pessimism, persistent physical symptoms such as headache, stomach cramps, pains that are not relieved with treatment. A persistent feeling of sadness, anxiety, or being empty, right? Thoughts of suicide or suicide attempts. So suicide is very, very important. I don't want you to get to the place where you are contemplating that. Please reach out. If you need to reach out to me for some referrals, I can definitely do that. There's absolutely no judgment on this end of the camera because I have been there, done that, and I have lived to tell because someone gave me some really good advice. So I'm giving you good advice. If you are clinically depressed, then there are things that we can do to help you. Now, if you're just situationally depressed, I have this situation, it's a short-term thing, but it's knocked me for a loop. There are other things that you can do. We've got great Bach remedies. I don't know if you're aware of these beautiful homeopathic flower essences, but there are, I think there's like 33 of them, and there's like one for every ailment under the sun that is emotionally connected. So we've got that to help you. We've got a great product that I use all the time, not for depression, but it's really good for anxiety. Now, anxiety presents in a lot of different ways. One of the most stressful things that you can do is what? Public speaking, right? And I do a lot of that. Now, I'm much, much better at it and less stressed at it than I used to be. But we've got this product called Ultimate Rescue, and it's got a lot of Bach flower remedies. I think there's 5 of them. They're at a very, very high homeopathic potency, and they're really, really good for situational depression. Let me explain kind of what that means. So I don't know who all's watching. I see a few faces, and thank you for tuning in. But just say, I'm having trouble with my kids. We have kids. All of us maybe have kids. My kids are grown, but my kids are now not suffering from a scraped knee, but they're suffering from grown-up adult problems. I'm still a mom, right? So if I get a call from a child or a close friend or a sister or somebody that I'm connected to, and they're having real adult problems, my heart starts to break and I get very, very upset. And I'm the kind of person, I'm very empathetic, and I'll just start, I'll start crying and all that kind of stuff, which is not good for me and my business, okay? And so when one of these things happen, I get that bottle of Ultimate Rescue, and I'll put a couple of droppers right under my tongue. I'll do it in 15 minutes. I'll do it again in the 15 minutes. So within 45 minutes, I have snapped that cycle. I can breathe again. I can focus on my work again. I can still pray for my family member that's in trouble, but I'm not all out of control and obsessing about it because I can't do anything. Because why? They're grown-up people and they've got to take care of their own stuff. But this is really, really good. So if you're in a situational issue, you've got an ailing parent, you've got things that you can't control, but it affects your life. It doesn't change your situation, but it changes how you respond to it. And I am so, so happy to be able to offer this to you. So that's a great, great thing. So we have that here in the clinic if you need that. So those are some things that you can do. Obviously, YouTube is great for inspirational speakers and all that kind of stuff. I totally appreciate. So number 5 on the list is fibromyalgia. Now, a lot of times your doctor will tell you, maybe not quite today they'll tell you because I think it's more common, but I remember about 15, 20 years ago, if people would present at the doctor's office with fibromyalgia symptoms, the fibromyalgia or the doctors would say, oh, it's just all in your head, it's just nerves. Well, yes, it is that. So, although the first symptoms you may think of when you think of fibromyalgia is chronic pain, chronic fatigue is also a significant part of this syndrome. So if you are tired, and nothing will alleviate that, then you might want to have some lab work done and see if you might have fibromyalgia, okay? Approximately 10 million people in the United States have fibromyalgia, and the condition affects 3 to 6% of the world's population. The majority of those affected, which is 79 to 90%, are women, okay? So if you are a girl, then you have a real high chance of getting this. Now, I'm not saying that this is contagious. I'm not saying that at all. I'm saying if you are chronically fatigued and nothing seems to work, if you've come in here and you've seen me and you're still fatigued, well, that's never happened, so I can't really go there. But if you've done all that you know how to do, then this might be something that's going on with you, is this chronic fatigue there. Okay, it can occur alone or with other conditions such as rheumatoid arthritis or lupus. Now, I tend to think that fibromyalgia is a nerve issue. I tend to think that it is an autoimmune issue, and I tend to think that the Epstein-Barr virus is at the root of it. So, why do I think that? Well, I think that because 95% of adults in the North American continent have Epstein-Barr virus. It's a virus that is just absolutely everywhere. As long as you do not suffer any kind of trauma, you probably are going to be okay. But that virus is like a bomb in your body just waiting to go off whenever there is trauma. So don't ignore it. Get some help, and we can definitely, work with you on that. So the cause of the report says that the cause of fibromyalgia is unknown, although experts have noted that the central nervous system appears to be hypersensitive in people with the disease. Diagnosis is a challenge as there is no definitive test, and the signs and symptoms mimic those of numerous other conditions. So this is why a lot of times the doctors used to say it's all in your head. The kind of tools that I do, okay, we've talked about EAV, electronic acupuncture, according to Dr. Vall. We do this here in the clinic. It's non-invasive. It doesn't hurt you. But what we do is we check for vibrational signatures. So I just want to take a little pause here and explain what a vibrational signature is. So hopefully people can catch up if you feel like I'm talking in a foreign language. Every human being has a vibrational signature all your own, just like your fingerprint, just like the patterns in your eye. So we've got a computer tool that has algorithms set up to see, as we touch certain systems in the body, like your respiratory system or your circulatory system or your central nervous system, all the different systems in the body, we can tell if that system is vibrating at the optimum frequency. Now, don't ask me what that is because I do not know. I have a tool that does all that for me, okay? I did not develop the tool, but I have spent tons of money to learn how to use the tool, and it just really turns around conditions, and I'm very happy to have this tool. Everything that lives and breathes has a vibrational signature. So we were talking about the Epstein-Barr virus. The Epstein-Barr virus has a vibrational frequency. Candida has a vibrational frequency. Depression has a vibrational frequency. Everything that can go wrong with you has a vibrational frequency, right? Because radio waves, light waves, electromagnetic currents, your whole body, your heart is an electromagnetic pump that you have to have water and you have to have minerals to make it work. So electricity really does run the universe, and we need to see that all of your vibrational frequencies are where they need to be. So with fibromyalgia, it has a frequency, and we can test to see if you resonate with that frequency. So if you resonate with that frequency, it's a pretty good hint that if we give you supplements that work on that frequency, it's going to take that frequency and make it, we want it to be undercover or we want it to be dissipated. So if you're not resonating with that frequency, you're not going to have pain. So let me try and break it down a little bit differently. You have a headache or you have a toothache. You take your ibuprofen, your aspirin, your Advil, whatever it is you take, right? And within 20 minutes, what happens? the pain is gone if you are fortunate. Why is the pain gone? Did the ibuprofen et al., did they help fix the problem? No, they didn't help fix the problem. They just turned down the frequency so that you would be more. Is find out how you are resonating, and if you're resonating for fibromyalgia, then it is something that we can talk about and work through. Now, just to be very clear, I am not a medical doctor. I cannot diagnose and prescribe. What I can say is you have a frequency of this. Sure, everybody knows where I'm coming from, okay? Because holistic people prescribe. All right. He says the symptoms also vary considerably from person to person. So these are some of your symptoms for fibromyalgia. It is fatigue. It is chronic pain, stiffness, tenderness of muscles, joints, or tendons. It is restless sleep. It is anxiety and mood changes. It is depression. It is problems with memory, concentration, or attention. It is abdominal pain related to irritable bowel, okay? It is irritable bladder, headaches, migraines, tingling, and numbness. So I would say if you have one of those things, I wouldn't think that was a big deal. But if you have a multiplicity of these symptoms, then you might indeed have fibromyalgia. And as I said earlier, I think that is part of an autoimmune presentation. And so, and one reason I think that is because, as the author of this piece says, that it comes along with rheumatoid arthritis or lupus. Lupus and RA are autoimmune diseases. Now, I will just tell you, the autoimmune diseases are when the body gets confused. Now, your body is very, very smart. Your body wants to be well. Your body wants to be healthy. When you have an autoimmune disease, the immune function, the innate immune function of your white blood cells, your T cells, your natural killer cells, all of that, they start attacking your own tissue instead of attacking the bacteria, all that kind of thing. So what we do, and we've been very, very successful with this, is I don't even want you to come and make an appointment to see me if you think you have an autoimmune disease. If you go to the doctor, they can do ANA antibody tests, okay? There are different tests for different diseases. And if you have these antibodies, it is because the body has made antigens that it is causes this. As I said earlier, it's too much viral, it's bacterial, it can be fungal, it can be chemical. I mean, we live in a very dirty place. The ship channel is just right that way. And they have fires and they burn off. That happens, then we get that toxic load in our bodies. And so what we do, if you come and you say, I have an autoimmune disease, we don't even want you to make an appointment. We just want you to start yourself on the RCCP. That stands for Restoring Cellular Communication Pathways. We have it here in the clinic. It is fabulous. I have said out loud on more than one occasion, everybody over the age of 50 needs to do the RCCP at least once every year. It is a total reconnect, reboot for us older people so that everything works like it did when we were younger. So it's really, really good. And autoimmune people or cancer people, we want you to do it for 90 days. And you will feel amazing. You will feel totally different. And it resets the biological terrain so that your body does not stay confused. Okay, so I'm just going to throw that out there. I know it's a lot of you using your hard-earned dollars to come in and see me. And I say, yeah, I agree with your doctor. You've got this autoimmune thing, so now I want you to go and do this RCCP. I'd rather just take your doctor's word for it, did the RCCP, do that for 90 days, then come see me and we'll see about how we can go about unraveling it. We have been able to unravel it on multiple occasions. It takes diligence, it takes intention, but it absolutely can happen. So this is what we do. This is what we do here. We've been able, one of our most famous things that we did is that we had a lady that came Lyme disease, she had fibromyalgia, she's got chronic fatigue syndrome, and she also has Hashimoto's. So that's a big bundle. That's a big bundle. And we worked with her for a little over a year. And her last blood work that she had with her thyroid peroxidase antibodies, which is you have to have greater than 9 on your blood test to be diagnosed with Hashimoto's. And on her last blood test, which was just last year, her TPOs were 1, which is huge. That's a huge turnaround. She feels so much better. We're still working on the Lyme. We're still working on other things. It takes time when you've got multiple things, but these things can be resolved. They can be reversed. It takes time and it takes dedication. So I see that I am just about out of time, and I don't want to go on any further and then have to rush through it. So I just don't even want to do that. So RCCP. RCCP is it's a kit that we have. It's got 7 different supplements in it. It's got your ionic minerals. It's got spore form probiotic that lives. It can go through the digestive system without being chewed up by digestion, and it is antibiotic proof. You won't lose that. Okay. It's got digestive enzymes. It's got gut associated lymphoid tissue to repair that. And there's another formula in there that repairs your neurotransmitters. So if you've got that situational depression, you need those neurotransmitters repaired. It does that. So those are 5 rebuilding supplements. The other 2 supplements, because there's 7 supplements, one is a cellular detox that goes after heavy metal, viruses, bacteria, candida, and parasites at the cellular level. And then the 7th component is the colon piece there, and it does this. It's a colon detox: parasites, heavy metals, viruses, bacteria, and fungus. So we all have these things. We live in a dirty atmosphere. We don't live in the Garden of Eden. All of us have parasites. All of us have bacteria. All of us have viruses. We have heavy metals and fungus. I mean, we live in the dampest part, probably in the United States. Well, maybe not in the whole United States, but we live in a swamp area with 100% humidity most days. So fungus grows in our area, and these spores are all around us. So I do RCCP, Restoring Cellular Communication Pathways. I do 1 cycle every year. Okay, sometimes I do it every 6 months, depending on what I'm going through, depending on if there's a lot of trauma, Harvey, whatever, how I'm feeling, that kind of thing. Anybody over 50 needs to do it once a year. Anybody that has an autoimmune challenge or a cancer challenge, they need to do it for 90 days, and then we see where we go. And yes, Rhonda, time, dedication, and faith. Faith is the important thing, because what? Jesus is the healer. Your body knows how to heal itself if you have the right supplements and you do what you need to do, the right lifestyle, the right love life, the right mental attitude. All of that factors in. So these things can be reversed. We only got to 2 things today, so we definitely will be having part 3 next week. And so thank you for taking time out of your day to join me. I hope you've learned something. If you have any questions, go ahead and pop them into the box and we'll get back to them today. It's a busy day, but it is the weekend. Be good to yourself. Relax. Enjoy your time away. And I will see you next Friday. Take care. Thank you so much.